Mhm.
This is a quick
Yeah.
disclaimer that this webinar is being recorded and remaining on the webinar is indication that you consent to the
Thank
recording.
you.
This informational recording will be posted to our PHE Helper website. Please feel free to submit any questions you may have in the chat throughout the training, and DHS will provide a Q&A follow-up via email after the presentation. Additionally, materials from this session, including the slide deck, the webinar recording, the Q&A for those questions submitted before and during the presentation, and a timeline of what MA recipients will see for communications when and when they'll see them will be linked in the DHS PHE Helper email coming soon to your inbox. So a couple of quick things. Our webinar last week for renewals, someone had asked if closed captioning was available. It appears the user needs to turn this on. So if you would like to use closed captioning, there's a small, or there should be a small CC with a little, or a small CC in the little, in the left-hand bottom corner of your screen, where you can click to enable those captions. Okay, I see, and the press office had included that as well there in the chat if you need those instructions. Additionally, sometimes the quality of the recordings has an effect on the cameras and the microphones being turned on. So if you could switch both your camera and your microphone off, that will help us to have our best quality recording for this resource. So that would be greatly appreciated if you could do that for this session. Okay, and without further ado, we'll get started. The Pennsylvania Department of Human Services Office of Income Maintenance welcomes you to our webinar, Long-Term Care and Financial Renewal Process. To kick things off, I'll introduce myself. I'm Lexi Dysonroth, the Executive Assistant for the Office of Income Maintenance, and my partner today is Marcia Mikas, Human Services Program Analyst Supervisor with the Office of Income Maintenance Bureau Policy. And I'd like to take a moment just to thank you first for joining PADHS in our effort to keep Pennsylvanians covered after the expiration of the continuous coverage requirement for Medicaid at the end of the COVID-19 federal public health emergency, also referred to as the PHE. As many of you already know, the PHE was extended through mid-January of 2023. Our federal partners have committed to giving states a 60-day notice prior to the official expiration of the PHE. From now and through the unwinding, DHS will continue to send valuable information regarding the status of the PHE and how you can assist. We hope today's webinar is a first step to doing just that. You can also receive public health emergency updates from DHS by registering through our helper listserv, and I'll put the web address where you can register for that distribution list in the chat if you haven't already had the opportunity to do so. So I think it's time that I'm going to turn this over to Marcia to give an overview of the nuts and bolts of the long-term care financial renewal process and what that looks like for recipients and those that are there to help them navigate through it. Marcia?
Hi, sorry, I couldn't find the unmute button. So thank you, Lexi, for the introduction. So the purpose of this presentation is to go over the annual long-term care financial renewal process. So we're going to discuss today the form sent before and with the renewal packet, the documentation that needs provided for the renewal to be considered complete, the actions the client can take if the renewal packet is not submitted on time or if the client is determined no longer eligible at renewal. And I'm also going to touch on the COVID-19 public health emergency and its impact on long-term care financial renewals. But before we get into the renewal process, I was asked to give a very brief summary of long-term care eligibility requirements and categories of long-term care eligibility. So there are three main eligibility criteria. The first one is functional eligibility, the second one is non-financial eligibility, and the third one is financial eligibility. So for functional eligibility, a client must meet the appropriate level of care. Usually it's going to be the nursing facility level of care for a client in need of or receiving long-term care facility services, and for most waiver services. The CEO does not, or county assistance office does not go out and assess functional eligibility, but they do need verification that the client is functionally eligible. And that verification is provided either via the MA51, which is the medical evaluation form for long-term care facility services, or it's provided to the CAO via the PA 1768 Home and Community-Based Services Eligibility and Eligibility Change Form for waiver. Next, we have non-financial eligibility, and this includes citizenship, identity, enumeration, and residency. Although these requirements need to be reviewed and documented, we need to verify them at application. Usually these things don't change, so they don't need to be re-verified at renewal. For financial eligibility, we can break this down into two parts. So we have income and resources. For income, we are looking at gross income of the individual applying for long-term care services. If the client is married, we are not looking at spousal income. We are going to take gross income of the client applying and compare it to 300% of the federal benefit rate. That amount, or that limit, income limit, is $2,523 a month in 2022. And that amount is going to increase starting in January of 2023. And we don't know what that amount is yet for 2023. If the gross monthly income exceeds this amount, and they're applying for long-term care facility services, they're probably still going to be income eligible. That's because we have a second way to look at income eligibility for long-term care facility services. And that would be to take 6 months of gross income, subtract 6 months of medical expenses, and compare it to the semi-annual income limit of $2,550. The reason most people are applying for long-term care facility services with excess income are eligible is because the medical expenses that we use that we can deduct from gross income include the average private pay rate of the nursing home where the client is residing. In Pennsylvania, currently the private pay rate is over $14,000 on average in the state of Pennsylvania. So when you're taking 6 months of medical expenses that include that average private pay rate that's so high, you're usually going to be income eligible. The problem here is with home and community-based services eligibility. Waiver recipients don't have that option of looking at semi-annual income and deducting nursing home private pay rate as a medical expense. So if you're applying for home and community-based services and you have excess income, unfortunately, you don't have as many options. You can either possibly be eligible for medical assistance for workers with disabilities, or MAWD, but this only works if you are disabled according to the Social Security Administration, if you are working and getting paid, and you are between the ages of 16 and 65 years old. If you don't meet those requirements, then you're going to have to spend down to straight medical assistance income limits. That income limit is currently only $863.10. So the client would have to incur enough medical expenses in a calendar month to reduce the income to $863.10. Then the client would be waiver income eligible for the remainder of the calendar month. And they'd have to provide this new verification of incurred expenses every month before they're eligible for the remainder of the month. Not too many people living in the community can afford this option unless maybe they're living with a family member who's paying the rent or mortgage and the all the shelter and utility costs. For resources, the resource limit is $2,000 with a standard $6,000 disregard. So essentially an $8,000 resource limit if incomes equal to or less than 300% of the federal benefit rate. For nursing facility applicants or recipients with that excess income, the resource limit's only $2,400. Now I'm going to just touch on long-term care categories. Long-term care facility and waiver categories are designated with 3 letters. The last letter is N for nursing home if they're receiving long-term care facility services, or W for waiver if they're receiving home and community-based services. The first letter just signifies basically the income and resources. For long-term care facility, you can see the first letter starts with either a P or a T. Those with a P means their income was at or below 300% of the federal benefit rate, and so their resource limit is $8,000. For the T, that means we determined eligibility using 6 months of income and deducting those 6 months of medical expenses. So their resource limit is only $2,400 and their income was over 300% of the federal benefit rate. For waiver services, you can see that there are no waiver categories that start with a T, and that's because, as I said on the previous slide, we don't have that semi-annual income option for waiver services. Now, of course, there's an exception to this 3-letter designation rule, and that would be for SSI recipients. SSI recipients whose only source of income is SSI are going to remain eligible in the SSI category A, J, or M, and they are eligible for long-term care facility services that designated by program status code 45. The 45 is entered on the case after the Social Security Administration updates their information in their system, showing that the client is residing in a nursing home. We also have a facility code, a few different long-term care facility codes. One of the most common is 36. It stands for private nursing facility. The point of the facility code is just to help ensure that the nursing home can get paid for nursing home services. For waiver recipients who are receiving SSI, they also will remain in the SSI category A, J, or M, but their program status code will remain 00, and they will have a waiver code entered. For example, waiver code 20 designates the Community Health Choices waiver. Each waiver has its own code. Now, there is much, much more information on MAUD in the MA handbook, eligibility handbook, and there's much more information on long-term care eligibility and categories in the long-term care handbook, and there's links to these handbooks at the end of the presentation. Before I start to discuss the renewal process, I just want to mention for the remainder of this presentation, I'm going to refer to both long-term care facility and home and community-based services simply as long-term care, because the majority of the renewal requirements are the same for both long-term care facility and home and community-based services. I will differentiate though when it's needed. So this slide provides the federal regulations that state that we must complete a renewal at least every 12 months for the aged, blind, and disabled population. And that population includes long-term care and home and community-based services. Now, financial eligibility, again, it's redetermined annually. Functional eligibility and financial eligibility are 2 separate processes. The CO needs verification of functional eligibility application, but they don't need it again at financial renewal. Once they're authorized, we don't need to see verification of ongoing functional eligibility. We just need to see documentation if the client's functional eligibility changes. So if at some point after they're authorized, they're no longer eligible functionally, then the CO needs a copy of the MA51 medical evaluation form verifying the change for facility services, or the PA 1768 verifying the change for waiver services. Now I want to touch on how the COVID-19 public health emergency has affected long-term care eligibility and renewals. On January 31st, 2020, the federal government declared a public health emergency due to COVID-19. It was renewed in 90-day increments and is currently set to expire in January of 2023. Now, the government has stated they are going to give states 60-day notice before terminating the public health emergency or before it expires. The Families First Coronavirus Response Act, or FFCRA, was signed into law on March 18, 2020. Section 6008 of the FFCRA provides a temporary increase in federal funding to states who agree to keep Medicaid beneficiaries eligible on or after March 18, 2020, open for benefits until the end of the public health emergency, even if they're no longer financially eligible. So Pennsylvania has agreed to this provision. So we have been keeping long-term care recipients who are validly enrolled on or after the public health emergency start date open for Medicaid, even if they're no longer financially eligible. Now, there are a few exceptions. States are allowed and should close Medicaid beneficiaries who passed away, who moved out of state, or who validly or who chose to withdraw from Medicaid benefits. Once the public health emergency expires, states must complete a renewal for all maintained individuals before we can terminate Medicaid benefits. So Pennsylvania is working hard to ensure that all recipients are aware that renewals are important and that they must be completed timely. So this is really important to Pennsylvania and to the advocates, and that's the purpose of this presentation today. Now I'm going to discuss the renewal process itself. Personally, for me, so I can remember the steps, I break it down into 5 steps. The first is sending the change reporting flyer. Then the second is sending a pre-renewal packet letter. Then it's generation of the renewal packet. Then it's the client's returning of the completed renewal to the county assistance office. And then it's the actual processing of the renewal. So I'm going to go through each step a little bit more and talk about the forms involved. So the renewal process for medical assistance and long-term care begins approximately 90 days prior to the renewal due date that's stored in our electronic client information system, or ESIS. So if we have a long-term care facility recipient who has a renewal due date of December 31st, then the whole renewal process begins in October. So the first step in the renewal process is the mailing of the change reporting flyer to the recipient. And this reporting flyer is also known as Form CM-537. Now, the purpose of this flyer is to remind recipients of changes that need to be reported because they may impact financial eligibility. It's to explain how to report the changes via Compass or different modalities. It's to provide the link to Compass and how to get My Compass mobile app, and how to sign up for text message alerts for DHS. And we're going to get more into Compass and text messaging later in the presentation. The second step in the renewal process is the pre-renewal packet letter, or Form CM-640, that's sent. So this form, this pre-renewal packet letter is sent after the change reporting flyer that we just talked about, before the renewal packet. It's a new letter. It was created as part of getting ready for the public health emergency unwinding. And it's just another way to remind long-term care or any Medicaid recipients that a renewal is coming up. Specifically, it tells the client that a renewal must be submitted to remain open for Medicaid benefits or long-term care benefits, that they should expect a renewal packet within the next 60 days. It gives some brief information on how to complete the renewal, including information about completing it online via Compass, who to call with questions about the renewal, what to do if found no longer eligible for Medicaid at renewal, and it provides a frequently asked questions sheet explaining the public health emergency and its impacts on Medicaid benefits. Step 3 of the new renewal process occurs when the renewal packet is generated and sent to the client. This process starts about 60 days prior to the renewal date. So if we go back to our long-term care facility recipient who has a due date of December 31st, then process will start in November. So this slide just explains that there are 2 different ways the county assistance office is going to generate a renewal packet. Most long-term care budgets will be automatically scheduled. So those renewals will automatically be scheduled by our electronic client information system, or ESIS. However, some individuals receiving waiver services might also be receiving SNAP benefits or TANF cash. If they're receiving another benefit besides Medicaid, then they may need to be manually scheduled by the CAO. The renewal packets are still the same. It's just that if an interview needs to be scheduled, the CAO needs to be involved in scheduling that interview. Although Medicaid does not need a telephone or face-to-face interview, some other programs do. There are several types of renewal packets that can be generated to the recipient, and the type and content of the packets are dictated by what benefits are currently being received by the individual. But all long-term care renewal packets are going to include the instruction sheet, a renewal information letter, the renewal or application form, and voter registration information. So I'm going to go through each form in the upcoming slides here. So the 1903 or instruction sheet, it's very basic. It's provided in all renewal packets. It's a very high level overview of the steps the recipient must take to complete the renewal process. The renewal information letter, or PA 253, is sent in all renewal packets. There are a few different versions depending on what benefit is being renewed. For long-term care, it's most often going to be the 253 RM. Again, it just depends. It's a little bit different based on what programs or what benefits the client is receiving. But all the 253 series, they're going to have the due date, and it's in red on this image. That's the date. All the information needs to be provided to the county assistance office so that it's considered on time. It tells you what benefits being reviewed. It provides instructions for completing the renewal. It gives a list of items that must be provided in order to complete the renewal process. And it asks the recipient to review the back of the letter where pre-populated information is listed so that the client knows what information we have in our system. And that's the backside of the 253 RM. Again, it tells you when the information needs provided to the county assistance office, and it tells them what income and resources we already have on the case so that they know they need to provide updated information for these sources. They can add in anything additionally or cross anything out that's no longer correct as well. Now, every packet contains an application renewal form. Most long-term care budgets will get the PA 600L. It's the medical assistance financial eligibility application for long-term care supports and services. It is used, the 600L is used at both application and renewal. If the client is receiving long-term care, usually home community-based services and another benefit program such as SNAP, then they're going to receive the PA 600R, which is the benefits review form, instead of the 600L. Now, whether it be the 600L or the 600R, the client is going to provide a copy that has pre-populated information on it. So the pre-populated information includes what we already have in the case for name, address, phone number, demographic information, income, and resources. Clients are instructed to review what's pre-populated on the application or renewal form. And again, they can cross out anything that's no longer correct or that they no longer own. Maybe they stopped working, so they're going to cross out wages from whatever job, or they may add in, maybe they have a new bank account and they need to add that in. Anything that's any of those income or resources on that form need to be verified. The application or renewal form must be signed. This slide gives the federal regulation that requires a signature. So this is very important. It's the signature field on the rights and responsibilities page that is mandatory. It must be completed to be considered valid. Now the PA 600L, this is the form that most long-term care recipients are going to receive in their renewal packet, has two places that they could sign. The image on the left is the rights and responsibilities page. By signing this page, they're agreeing to their rights and they understand the responsibilities. This is the screen or the page that must be signed to be considered valid. On the right side, this image is the affidavit. It just is a place on the paper application to list who the power of attorney or guardian or representative of the client is, who has the right to represent on this renewal. This page is not mandatory to be signed at renewal. We are working on updating the paper application to include this information in the body of the 600L application. The complex application already includes representative power of attorney information in the body of the application. The PA 600R, this image shows the rights and responsibilities in the PA 600R benefits review packet. And again, by signing, the client is agreeing to the rights and understands their responsibilities. So the following information must be verified at each long-term care renewal: gross income, resources, and verification of fair consideration. So for current gross income, verification could include a pension award letter, pay stubs, or if they're self-employed, a Schedule C tax form. For resource verification, it could include a statement or life insurance cash surrender value. If the recipient states on the PA 600L that they gave away or transferred assets for since the last application or renewal, they must provide documentation to prove they received fair consideration for the transfer, because this is a requirement for long-term care and home community-based services. So if, let's say, the long-term care facility recipient gave away their car 3 months ago, or sold their car 3 months ago, they need to provide verification of the date the car was sold or transferred, verification of any money received for the sale or transfer, and where the money was deposited or how it was spent. So we must verify that they received fair consideration. Now, before we leave this slide, of course, there's always an exception to the rules. So I said that everyone needs to provide verification of resources that they own at renewal. However, if the client is receiving either long-term care facility or waiver services and they're under age 21, resources are excluded, so you don't need to provide verification. If the individual is receiving home and community-based services and they're living with their child who's under age 21, then again, resources are excluded. They don't need to provide resource verification. Once the recipient or the recipient's child turns 21, then we do need to verify resources and they are counted. Once the renewal form has been completed and signed, all verification has been gathered by the client, then the client needs to submit it to the county assistance office. And again, they must submit all verification and the signed renewal form by the renewal due date. Returning the renewal packet is step 4 in the renewal process. And there's going to be several ways that they can submit the renewal packet. The easiest, best, most efficient way to do it is online via Compass, our electronic application and renewal website. If they renew online, they can also scan and attach all their verification documents at the same time, and they can e-sign their renewal. If they don't want to use Compass, they can always mail in the renewal packet. They can do that via the business reply envelope, prepaid postage and all that's sent out. The renewal envelope is sent with all renewal packets. They could also drop everything off in person at their local county assistance office, or they could call and go through the renewal in the customer service center. But if they do that, if they go through the renewal process over the phone, then they still have to send in or bring in or scan and attach via Compass all their documentation, their supporting documentation. So again, we really stress using Compass. Now this slide just talks about how recipients can receive additional reminders about the renewal process. And they can do this via text message or emails they can sign up for. Text messages will be sent to them in either English or Spanish, depending on their preferred language. They can sign up for text messaging in Compass or at this link we provide here. They can sign up for emails in Compass. If they do not sign up for either text messaging or emails, they are going to receive automated phone calls. And these are like reminders that renewal is coming up, or reminders, hey, you only have X number of days left to provide everything. So these are important reminders, and we're trying to stress the importance of this again because of the unwinding of the public health emergency. We don't want to see people lose their benefits. Now, processing the renewal is the final step in the renewal process. Once the completed packet and verification is received, the county assistance office will review and determine ongoing long-term care eligibility. If the recipient remains eligible, then the renewal date is set 12 months out. So our long-term care facility recipient who had a due date of December 31st, 2022, provides all the information, he remains eligible. So now his due date is set for December 31st, 2023. If the recipient's long-term care facility cost of care changes, they'll receive a notice of the change, or if benefits change in any way, they're going to receive a notice. If the recipient becomes ineligible for medical assistance or long-term care after the county assistance office reviews, or benefits are reduced, then eligibility is going to be terminated or reduced, and they're going to receive a notice providing this information, why the benefits were terminated or reduced, the date that the benefits will be terminated or effective date, and they're going to receive this notice. It's called an advance notice. The notice will have a date 15 days from the mailing date. If the client appeals within that 15 days, their benefits will remain open during the appeal process. If they are found not eligible at appeal, then they may be subject to repayment for the benefits they received, though. Any notice is going to include fair hearing paperwork. It's going to explain the hearing process, the fair hearing, how they can appeal if they don't agree with the decision. It's like a step-by-step. It's an easy sign this form, give a brief explanation of why you don't agree with the determination, and send it in. Now, if the renewal packet is not turned in or it's not complete, then long-term care benefits will be terminated. But individuals have, if benefits are terminated, the recipient has 90 days from the date of termination, known as the reconsideration period. If a completed packet and verification are received during this time, the County Assistance Office will review eligibility for long-term care. If the individual is eligible for long-term care based on the information submitted, then the County Assistance Office will reopen benefits with no gap in coverage. If the information submitted is still incomplete or the client is not eligible, then the CEO is not going to reopen benefits. And after that 90-day reconsideration time frame, the client then reapplies, or then they are going to possibly be opened again, but there will probably be a gap in coverage. We're not going to go back to the date benefits closed if they're not following the reconsideration time frames. In order to ensure that all the individuals are aware of this reconsideration period at renewal, a new letter has been developed, and this is the reconsideration period letter, or Form CM-642. It's mailed after long-term care closes to recipients whose long-term care is closed for failure to complete the renewal process. It provides information explaining that Medicaid and long-term care can be continued if the renewal process is completed during the 90-day reconsideration timeframe. And it also provides information about how to complete the renewal, as well as instructions and information that may be necessary to complete the renewal. Now, the last portion of this presentation is some information that might help you to help clients through the renewal process. As you could probably tell, we've been pushing Compass throughout this presentation. Compass, again, is our electronic website for applying and renewing benefits, and it's available for recipients to independently submit the application or renewals, but it's also available to agencies or entities. They can sign up through Compass to become a community partner. This slide provides the Compass homepage. It provides the link to the community partner online self-registration quick reference guide, and provides more information on becoming a community partner. So anyone who wants to register to become a community partner, it's a self-registration, and it pretty much, there's information on the Compass homepage to become the community partner, and it kind of talks you through the process. Becoming a community partner really has its benefits. So once you're registered as a community partner, you're going to have access to what's called the Community Partner Dashboard. From this dashboard, community partners can submit applications and renewals on behalf of individuals. They can e-sign applications and renewals. They can view the status of applications they submitted. They can stop an application in the middle of the process of completing it, save it, and go back to it later to finish it. Up to 6 months later, it'll be saved. They can scan and upload verification documents for submission for the client. They can view renewal dates for active recipients. They have the ability to pull reports for their community partner agency. And they also have easy access to program information forms and policy handbooks for reference. So we really strongly urge registration as a community partner. This next slide provides some helpful links. As I said in the beginning of the presentation, we're including the long-term care handbook where you can find more information about long-term care eligibility. The medical assistance eligibility handbook provides a lot of detailed information on the medical assistance for workers with disabilities program, or MAUD. We have the COMPAS website yet again, and we also have the PADHS website. And as Lexi mentioned at the beginning of the presentation, we have the PADHS helper website and more information on end of the public health emergency. So for some key takeaways, in closing, I just want to reiterate some key points to remember about the long-term care renewal process. Make sure that recipients have provided the department with their most recent contact information, which includes mailing address, phone number, and email address. It's very important that we have the up-to-date contact information so we can ensure the renewal is sent to the right place, so that they get the renewal on time, they submit the renewal on time, and we keep their benefits open. Encourage recipients to sign up for additional modes of communication, such as text messages or emails, because these modes of communication get the word out about the renewal process and help them to remember that the renewal needs to be submitted. Become a COMPAS community partner to take advantage of the benefits we talked about a few slides ago. It's really a great tool for helping recipients apply for, renew, and maintain benefits. It's also great for entities and agencies that want to help clients apply for and renew benefits. Again, using COMPAS, they can apply for renew benefits all in one fell swoop. They can make sure it's signed, and so it's considered a valid renewal, and they can scan and upload all the documentation of income resources and anything else they need to provide. This ensures that the CEO definitely receives this. And my favorite slide is my cat, Homer. I believe, Lexi, we were going to take questions after the presentation.
Hi, Marcia. This is Lexi. I want to thank everybody for coming today. The webinar is full today, and I know that everyone has been submitting their questions through the chat. And I do appreciate that. If you do have additional questions, please do submit them through the chat, and we will loop back around with question and answers following, in an email following the webinar. So I'll talk to you about how we're going to do that in just a second. So first, I want to say how much we truly appreciate your dedication to helping individuals stay covered in Pennsylvania. The DHS and the Office of Income Maintenance really do, we're really excited about the amount of participation in today's webinar. It's truly astounding how many people truly want and have an interest in assisting and making sure that the end of the PHE and Pennsylvanians stay covered. So that's just wonderful. I mentioned at the beginning of the webinar that materials from this session, the slide deck, the recording of the webinar, I do think there will be less distraction. I think some of you are hearing some beeps throughout the presentation. The recording may help with that. Q&A for questions submitted before and during the presentation. And we really had some great questions come in and asked during this presentation, and we will follow up. And you'll also, I think this will kind of address a couple of things in the chat. You'll also see a timeline of what communications those MA recipients will see and when, and that will be linked in an upcoming DHS PHE helper email coming soon to your inbox. Additionally, previous content developed for PHE helpers that Marcia so kindly gave us a plug earlier in the presentation, as well as links to other PHE and renewal resources can be found. And I popped the address in the chat not too long ago, but that address is www.dhs.pa.gov/phe/pages/helpers.aspx. If you haven't signed up to be a helper yet, please do so you can receive updates regarding the PHE. And again, the materials from this presentation will be sent out through that email listserv, and there's so much more coming from there as well. So let me pop that list in the chat. You can continue to submit your questions here, and we will, oh, looks like somebody threw it in the chat. So I appreciate that. And I think with that, we will go ahead and end this session. Again, we'll wrap around with that Q&A that was submitted throughout the presentation. And I appreciate so much the participation from this webinar today. So everyone have a really great day, and thanks again.